Good afternoon, Boston Coffee, Disney Coffee, and McNulty team members. Hey, this is John Claudio Plonzo, just coming here to you for our open enrollment meeting for 2019. On the screen, guys, wanted to just take a couple of minutes with you to review the different medical plans that you have available to you as team members. This year, you will notice one small change. We have added an extra plan for you to choose from. The goal here, guys, is to give you a variety of options from low to high. So you have a low plan, a medium plan, and a high plan to choose from. And we were hoping to take a little bit of time today to review the plans and help you through your open enrollment. So once again, my name is John Claudio Plonzo. I'm with Insurance Office of America. We have the pleasure of representing your group. And, you know, guys, I understand that health insurance can be a pretty confusing topic, so this is definitely your meeting. Try to give you as much information as we can, and I'll definitely put my information up on the screen towards the end of the presentation so you know how to reach out to us if you have any questions. All right, so let's get started. Okay, so on your screen, guys, you can see that we are staying with Humana for our next open enrollment period. Humana is a great company, everybody, a good network, and they have offered us the most competitive rates for another year. So we'll be remaining with them. You can see that the three different plans that we have to offer are, the first two are HMOs, and that stands for Health Maintenance Organization. Now, guys, the really important thing to know about an HMO is that you do have to stay in network, okay? So you want to be really careful whenever you're using the plan to stay in network so that you have coverage. So both the low plan and the middle plan are HMOs, and then our high plan is what's called a point of service. And a point of service gives you a little bit more flexibility to go out of network if you need to. So just a couple of highlights, guys. I know that we tend to focus on the deductible, okay? So you can see we have different deductibles with the plans. For the low plan, it's $4,000, and for the middle plan, it's $2,000. And for our high plan, there's actually no deductible. So we'll talk a little bit about that. Now, what I do like to point out, everyone, is that you do get a lot of services with our plans without having to worry about the deductible whatsoever, okay? So, for example, primary care physician. On our plans, you go to see your doctor. It's a $40 copay. If you need to see a specialist, it's $65. And guys, we do have a virtual office option for virtual telemedicine option available to you that for $40, you can actually see a doctor right from home. And we'll have those in your packets for you to review. Other things that are great with Humana, you can see that on all of our plans, all of our preventive care, guys, and this is so important, you really want to make it a habit to go once a year to get your physical, you know, and that's really what this covers. For adults, your physicals. If your children are on the plan, it covers their well child exams, their immunizations. And at a certain age, for women, it covers your mammograms. And for all of us at age 50, it covers your routine colonoscopy. All of these are really important, guys. I have countless stories with what I do that folks have been able to catch potentially lethal diseases early because they went to get their physical. So it's really important, guys. I know it's a pain, but go once a year, get your physical, get your blood drawn, make sure your cholesterol is doing okay, make sure that your sugar levels are all right. You know, those are the kinds of things that you can catch diabetes early, turn your diet around, and get healthy. You can catch high blood pressure early, which can potentially lead to heart attacks. And guys, you know, the major one, cancer, you want to go and get screened so that if there's any indication of cancer that you catch that early. It's really important to catch cancer early to beat it. So that's why, guys, on our plans, these are covered at 100%. You pay $0 because we want you to go get checked out. We want you to make sure that you're healthy and that you're catching things early. All right. More good news with Humana. You can see that as long as you go to an in-network lab or x-ray facility, you pay $0 on our plans, which is great, right? You don't have to pay anything for labs or x-rays. And then I'll jump down here, just sticking with copays. You can see we also have copays for emergency room and urgent care. okay? So heaven forbid you have to go to the emergency room. You do not have to worry about the deductible. You only pay this $350 copay. Same with urgent care. These are like walk-in clinics, guys. You can go to a walk-in clinic for $100, okay? So that's kind of how the copays work. Now notice for our prescriptions on our low plan and our middle plan, we do have a small deductible of $250 for any brand name medications, okay? Your generic medicine, the maximum you'll pay is $10. But for any brand name medications, you do have a deductible to meet, and then after that, you'll start to get these copays. $40 copay for formulary, $70 copay for non-formulary. On the high plan, guys, there is no deductible for prescription, so just kind of keep that in mind, okay? All right, so the deductible. This is a little tricky. I like to go through it with you. What I really like to focus on, guys, when it comes to your deductible is inpatient hospitalization, okay? That's the really expensive item on the menu here. Heaven forbid, if you do have to go to the hospital, that is where you really have to be concerned with the deductible and your max out-of-pocket, which we're going to talk about. So what this means is if I do have to go into the hospital or I need surgery or I need an MRI, any of these other items that are subject to the deductible, I do have to pay that deductible first, okay? So I do have to, on the low plan, pay the first $4,000. Or if I take the middle plan, I only have to pay $2,000. After you pay your deductible, you do have to pay this coinsurance, okay? This is called coinsurance. And you can see it's 50% after the deductible. Well, now, I'm sure some of you are thinking, okay, John Claudio, my gosh, if it's, a hospital stay can be very expensive. It can be hundreds of thousands of dollars. If you're in the hospital for a month, it could be $100,000, How am I going to pay 50% of that? Well, guys, this is the most important number on this piece of paper is the max out-of-pocket, okay? And this is why all of us should have insurance, because if you do end up in the hospital, the maximum that you pay is $6,500. Once you have met that max out-of-pocket, you are done for the year. Insurance will cover 100% of your expenses after that. Now, your deductible counts towards the max out-of-pocket. So isn't that good? So once you pay your deductible, you only have $2,500 more to go before you hit your max. Now, guys, I know that $6,500 is a lot of money for sure, but I'll tell you what, when you owe a hospital $500,000, that's suddenly a good deal, right? So that is really the protection you're buying. There's two main protections you're buying, the max out-of-pocket and the fact that you're going to be a part of a network, okay, the HMO Premier Network. Now, I'll just give you an example. My daughter needed a minor surgery on her nose, okay, and that surgery without a network discount, the surgical center was asking me for $6,000, okay, for a 2-hour, not even 1 hour surgery, okay? But as soon as I gave them my insurance card, the network discount for that surgery dropped it down to $2,000. Now, I did have to pay the deductible on my plan because that was an outpatient surgery, for example, okay? So, but my point is that the two main reasons to have health insurance are your network discounts, number one, and your max out-of-pocket, number two. Super critical. All three plans work like that, except our high plan, okay? So if you do choose our high plan, you can see that some copays are much higher than our low and medium, and I'll explain that, okay? If you go to the specialist on this plan, it's $100, okay? The reason that this plan has higher copays for some of the more routine items like emergency rooms higher, urgent care is higher, okay, is because it has really good hospitalization coverage. So this plan is structured more to cost you a little bit more for the little things, and then heaven forbid if you do end up in the hospital, it does a great job if you're in hospital or surgery. Check this out, okay? So here you can see if I do end up in the hospital on the high plan, I only pay a $1,500 copay per day for 3 days. And if I need outpatient surgery, I just pay a $1,500 copay for my outpatient surgery. Okay, so, and this is a little bit bigger network. This is the National Point of Service Network with Humana. So a little bit bigger network, and you do have some copays for hospitalization. So that might be why you choose this plan. And then finally, that point of service element to the plan lets you go out of network. Now, I don't recommend it, okay, because as soon as you go out of network, remember those network discounts we talked about? Network discounts do not apply out of network, okay? So when you go out of network, a doctor can charge you whatever they want, and Humana will reimburse you based on what's reasonable and customary. So you have to be careful. If you go out of network, you still have to pay the deductible out of network. And remember, Humana is only going to reimburse you 70%. You pay 30%, but Humana is going to reimburse you 70% of what's reasonable and customary. So it's certainly helpful, guys. It's better than not having, it's definitely good to have out-of-network coverage, but very few of us use it because most of us as Americans are very careful about going in-network, okay? Now, if you're wondering, on the HMOs, you have out-of-network coverage for emergencies no matter what. Okay, so even if you're traveling, you're in a rural area where there's only one little hospital that doesn't accept insurance and something happens, emergency, don't worry. You still have emergency coverage out of network. Okay? Okay, so down at the bottom here, guys, you can see the cost per check for the health insurance. The company graciously contributes 50% of the premiums for you. So as a full-time employee of the company, I do want you to know that that McNulty, Boston, Disney makes a significant financial contribution towards your benefits. So these amounts here are after the company is covering 50% of your employee-only coverage. So you can see it's $32.96 per check. Now, what I do want to tell you is that you are paid 52 times a year, but we only take benefits out 48 times. Okay, so there are 4 weeks in the year that you will have no benefit deductions coming out. All right, so just to let you know that that's how that works. I do also want to tell you that all of these amounts here are taken out of your check on a pre-tax basis, which is really good, guys, because this is something that is important to me because I have to take family coverage. I have my wife and 3 kids. And the pre-tax benefit of buying my insurance at work is very powerful, everybody, because you save on Social Security, Medicare taxes, federal income tax, and any state taxes that you might have in your state. I'm not sure if Georgia has state taxes, but you get to detour all of those taxes with your health insurance. Now, the reason that I tell you that is because, yes, I know that this says that it's $32.96 per check for our plan, but guys, by the time you take the tax savings on that, you can knock 20% off that number, which is huge, you know? That's a lot of money. So I just want to share with you that that is how we structure the plans for you to help you save money on your health insurance, okay? So that's kind of how that works. Okay, thanks for hanging in there. Let's move on to dental and vision. I do want to show you guys how to look up doctors, and I'll do that for you quickly. And we have a little bit of homework for you to do with open enrollment. So I'll definitely show you that here in just a second. Okay, so our dental plan is actually also with Humana, which is great, guys. Humana is very good in this space. They're one of the top ancillary carriers in the nation. I have a really good network of dentists. And your particular plan lets you go in-network and out-of-network, okay? Now, I have a plan like this, too, because my dentist, even though, forgive me, everybody, I know I have been telling you to stay in-network as much as you can, but with dentistry, it's not as critical as with your medical. So I do go out-of-network with my dental plan. Okay, and the reason that I do that is because I really enjoy my dentist. Like, he's a great dentist, he's very caring, but he does not accept insurance. So that's what's really nice about your plan is that you can go in-network or you can go out-of-network if you would like. Now, the way this works, okay, your preventive items like your cleanings and your x-rays are covered 100% in-network. Now, they are out of network too, but remember, you're not protected by a network discount here, so you might get balance billed from your provider for just a little bit of your cleanings and x-rays, okay? Your basic services, this is like fillings and major services, this is like root canals and crowns. It covers 50%. So the way this plan works is it covers a percentage of your needs. Now, what's really great about our dental plans, guys, is they are unlimited, okay? So, and that is only Humana does that, by the way, okay? So that's really good. That's another good reason why we're with them, is that only Humana has these unlimited dental plans. So I hope you don't need this, but if you need 4 crowns, you're going to be able to get 50% of your crowns covered for all 4 crowns. You're never going to hit a max with our dental plans, which is very good, okay? Now, down at the bottom, same thing, pre-tax deductions per check only comes out 48 times. We do not deduct 4 times a year, okay? All right, let's keep this moving. Just want to try to keep this short and sweet for you guys. All right, vision, guys. Great vision plan, also with Humana. Got to tell you, they're really good in this space as well. Great network of vision providers, and you get a lot for your money. For $1.61 pre-tax, don't forget, you actually get a copay for your exam, and you get $100 to use to buy frames. So isn't that nice, okay? Personally, guys, I think just in the exam alone, the premiums pay for themselves for this plan. Now, I do tell everybody that you really only need this plan if you wear glasses or contact lenses, okay? Or if you want prescription sunglasses, something like that. You don't need the vision plan if you have good eyesight. This is really just to help you with the expense of corrective lenses, okay? Now, you can go once every 12 months for your exam. You can go once every 24 months for your frames. And you can get your lenses replenished once every 12 months as well. You can use the $100 for either contact lenses or frames, whichever you prefer. And even if you go over that amount, guys, you get a 20% off discount with your Humana Vision card, which is fantastic. Now, you can go in-network with this plan and out-of-network. But on this one, guys, I'm really going to recommend that you stay in-network because you can't beat these co-pays and these allowances out of network. If you go out of network, it's just going to give you $30 for an exam, $50 for glasses. Okay, so it's a little bit different. But again, for as inexpensive as it is, I think you get a lot for your money. Okay, so that is our vision plan. All right, really quick, let me show you guys how to look up doctors. It's very easy. I'll just show you this really quick. Here is the Humana website, okay? It's humana.com, and it's very easy. You just pick the medical, you pick medical plan, medical, dental, or vision. You'll want to select insurance through your employer and then put in your zip code. And remember, guys, on that handout, I tell you what the network is. So in this example, it's the HMO Premier is what I'm picking. And then you can select by specialty, name, all kinds of different avenues, okay? So we'll just do specialty. Or actually, yeah, we'll do specialty. Okay, so for example, you can type in PCP, and that'll bring up all primary care physicians, okay? And you just click search. And then it'll bring up all the participating providers in the HMO Premier network, for example. And this is just how it works on the dental and vision as well. So it's very simple. I really encourage you guys to, I mean, look at this. You have 1,300 different primary care physicians in that within 15 miles of that zip code. So I really encourage you guys, download the Humana app or come online with your computer and really get in the habit, guys, of always checking and making sure that the doctor you're going to see is in network. It's really important, okay? All right, homework. Yep, guys, I'm sorry, you have a little bit of homework. So in your packets that you will receive from management, there is a very easy selection form, okay? If you are making no changes or just wish to waive the coverage, this is the only document that we need back from you. Please be sure to put your name, your social, your date of birth, and then here, guys, in each section, you can see what you need to fill out. So, for example, let's say I'm enrolled in my health insurance plan. I don't want to change my plan, or I'm not making any changes like adding my children or removing my spouse or changing my address. There's nothing really like that I have to change. I just need to pick my new plan for open enrollment. Well, you're going to check this. I'm currently enrolled and I'm not making any changes to my coverage tier. And just let me know which plan you want to move forward with. Maybe you're on the current $2,000 deductible plan and you want to stay there. Just check that off. For dental, same thing, okay? Maybe you don't want the dental, all right? And so you say, hey, I'm not currently enrolled and I do not wish to enroll at this time. And maybe for the vision, you don't want to make any changes. You have the vision. You just check that off. And on page 2, you just sign, okay? Just sign here at the bottom and date, and that's it. Get this back to your supervisor or manager, and we'll be able to make your open enrollment elections very easily for you, okay? Now, if there are some of you that are not enrolled today and you would like to enroll, well, I do need your name, social, and all your other pertinent information to get you the coverage, to put you in the Humana system, right? Well, if you're new and you would like to enroll or you're not enrolled today, there is a full Humana enrollment form in your kit, okay? So here you'll just want to put, Boston or Disney, Inc., whichever entity that you work for. Our effective date for these changes, guys, is 6/1, okay, 6/1/19. And you just want to check off open enrollment. And then you're going to give me your last name, your first name, your gender, your date of birth, and so on and so forth, okay? If you're going to enroll your spouse or children in anything, the dental or the vision, I am going to need their information for that. So be sure to fill it in, okay? And then down here, you guys can actually skip this section, this prior medical. I have crossed out most of this, so a lot of this you do not have to complete. The dental, it is important. If you did have prior dental coverage, please be sure to fill that out. That is important. And then here in the medical section, you're just going to let me know what you would like to do. Maybe you just want to take employee-only coverage and just let me know which plan you'd like to enroll in. And remember, the plan names are on your handout. So coming back to this. Okay, just remember, they're right up here. So just let me know which plan number you want to enroll in, the 67, the 61, or the option 13. Just do that on your enrollment form, okay? Same with the dental, same with the vision. Just let me know how you'd like to enroll. And guys, just so that you know, you can mix this up, okay? So if you want to enroll employee only for the medical, but you want to put you and your spouse on the dental, and you want the whole family on vision, that's okay. You can do that, okay? So you can mix and match these 3 levels of coverage however fits what you and your family needs, okay? And then at the very end, you just want to sign the application that you're accepting coverage, okay? Sign, date, relationship, and that's it. You'll be done. Okay. Again, be sure to get this back to your manager or supervisor as soon as you can. Our open enrollment period, and guys, we're so sorry that we're this late. Things got pushed back a little bit this season with our Humana negotiations, so we are sorry that we're late. But this does go into effect June 1st, 2019. So be sure to get your forms back as soon as you can to your manager or supervisor. All right, guys. Up on the screen now is my contact information and your account manager, Jessica Acosta. If you have any questions, guys, please feel free to reach out to one of us. We'd be happy to help you. We know this stuff can be a little bit confusing, but we're here for you for any questions that you have. Okay? Hey, I really appreciate your time. Please be sure to get your forms in as soon as you can. And thank you so much for all your service to the organization. And thank you again. Have a great day.